Hey guys, Rodney here from CrossFit South Bend. Today we're going to talk about some natural ways to manage high cholesterol and to deal with high cholesterol. Now the first thing I need to say right off the bat, because we're dealing with more medical type issues, is I'm not a doctor, I don't play one on TV, nothing I'm about to say is meant to diagnose, treat, cure, or otherwise alleviate symptoms of a diagnosed medical condition. You should always consult your medical professional before starting or stopping treatment. This is only meant for general educational purposes. So, why are we talking about this subject in particular? Well, cardiovascular disease is the number one cause of mortality among both men and women. It's higher than cancer, it's higher than autoimmune disease. It is the number one killer across the board of both men and women here, particularly in the United States. So it really makes a difference to understand what's actually going on with cardiovascular disease. Is it the result, as people have told us, of high cholesterol? And if so, what can we do about that? What can we do to fix that? So in order to understand what's actually going on here, we first need to understand the standard of care. Now, it used to be the case that if you had a certain cholesterol number or LDL number, let's say, then you were prescribed a statin pretty much automatically by your doctor. The standards were revised in the past few years, and there's now these new assessment tools. So basically there are 4 questions that are asked. Do you already have heart disease? That's number 1. Number 2 is, do you already have diabetes? Number 3, do you have LDL that's greater than 190? And then number 4, is your risk of heart disease above a certain percentage? I believe it's 7.5%, based on a series of questions and family history that would determine your risk for heart disease. And if the answer to any one of those questions is yes, then the treatment, of course, is a statin. Now, there's been a lot of pushback from a lot of different areas, and not just conspiracy theories, but from very prominent cardiologists and researchers in the medical community saying that these new standards have artificially increased the number of people who are going to be put on a statin by their doctor, even though that is not medically necessary. And as we'll talk about in a separate video, there are all sorts of not good things that come along with statins. Statins, just like antibiotics, just like proton pump inhibitors, just like thyroid medication, like everything else we've talked about in these videos, can be necessary in very, very, very acute situations, in a very small subset of situations, but they are dramatically, ridiculously, unbelievably overprescribed today, and they are not without consequence. They can lead to all sorts of not good side effects, as many people have taking statins have experienced, and as we'll talk about in a later video. So that's pretty much the standard of care. And right off the bat, you should notice something about these questions, right? Do you already have heart disease? Do you already have diabetes? Do you already have LDL above 190? And then the very last one is your risk. This is sick care. This is the paradigm example of sick care. This is what conventional medicine does. It waits till someone is sick, till they already have heart disease, till they already have diabetes, till they already have an LDL above 190, and then it says, oh, we're going to prescribe you some drugs and surgery to get you out of the situation. That's not a good approach to healthcare, to being optimally healthy. And even if you want to say, oh, okay, I see the first 3, well, those are talking about already pre-existing, sort of bad states of affair when it comes to your health. What about this last risk question? Well, yeah, that's important too, but the solution isn't a statin. High cholesterol and heart disease are not caused by a statin deficiency. I'll say that again. High cholesterol and heart disease are not caused by a statin deficiency. Just like heartburn isn't caused by a proton pump inhibitor deficiency. Just like depression isn't caused by an SSRI deficiency. There are causes in the body that lead to these issues that, if they are not addressed, will lead to further issues and worsening of symptoms. And that's what we're going to talk about today. So at absolute best, as we'll talk about, statins are symptom control, and absolute worst, they are quite harmful in terms of the side effects and the things that they can do to your to your body and to your hormones and many other bodily systems. So what's wrong with the standard of care? So if you remember nothing else from this video whatsoever, remember this: high cholesterol is a symptom, not a disease. High cholesterol is like a fire alarm going off in your apartment or your house. Now, every one of us, if we had a fire alarm going off in our house or apartment, like actually blaring, not just beeping, but blaring, we would think it would be utterly ridiculous to take that fire alarm, disconnect it, and then throw it out the window and say, oh, problem solved, right? Because the fire alarm going off is just a symptom of there being smoke, of there being a fire somewhere in the house. And high cholesterol is just like the fire alarm. There is a reason, there is a fire that is going on that is leading to this high cholesterol. And if you don't put out that fire, you can take as many statins as you like, but it's not going to fix the underlying issue. So if you walk away from this video with nothing else than this idea, take the idea away that high cholesterol is a symptom, not a disease. And artificially lowering cholesterol numbers with a statin does not fix the underlying problem. It is the equivalent, metaphorically speaking, of throwing out the fire alarm without putting out the fire. So that's a really important point to keep in mind. And just like I said before, in connection with that, high cholesterol is not caused by a statin deficiency. It is caused by something in the body that is leading to that issue. And if you don't fix that issue, then something goes wrong. In a normal, healthy human being, high cholesterol does not happen. If it is happening, there's a reason why it's happening, and you need to get to the bottom of what that reason is. What else is wrong with the standard of care? Well, there are better blood markers for high cholesterol and better blood markers to determine whether someone is at risk for heart disease than any of the ones listed up here. In particular, something called LDL particle number. And no, this is not the same as the LDL you get checked for every year by your general practitioner. LDL particle number is a measure of the total number of LDL particles circulating in your blood. And we could go really into depth about all this. And if you're interested, the best resource I know of by far on all of this is Chris Kresser's High Cholesterol Action Plan, if you're really looking to delve deep into the science. But the headline here is that LDL particle number is by far a better marker of overall cholesterol levels and heart disease risk than total cholesterol, LDL cholesterol, and HDL cholesterol. And what's really surprising about this, and what's really unfortunate in my way of thinking, is that you can be someone who has very high LDL particle number, meaning you're at high risk for heart disease and cholesterol, but your normal cholesterol numbers will look okay. And vice versa. You can be someone who has high, typical cholesterol numbers that we run, total, HDL, LDL, so on and so forth, but your LDLP, your real risk of heart disease, is low. So you could be artificially put on a statin when you don't need to be, or vice versa, you might be told that everything's fine when everything's not fine. Now, there are many other markers like LP(a) and LPPLA2 that are markers of inflammation that can be helpful in determining heart disease risk. But the basic headline is that the ones we typically get, maybe with the exception of triglycerides, which is decent, really aren't too much use unless they're extreme. Third, statins are symptom control at absolute best. And symptom control is sometimes necessary. If someone has a genetic predisposition to familial hypercholesterolemia, then yeah, we need to do something. That's, if someone has 2 copies of the ApoE4 gene, which genetically, which first of all is extremely rare, and you get significant increase in risk of heart disease and Alzheimer's risk, then yeah, maybe a statin is necessary. Even if someone's a carrier for ApoE4, we need to monitor their heart health, and that's more common, but nowhere near as common as the number of people on statins these days. So at best, this is symptom control. And the problem with symptom control is A, that it never stops. You keep having to take something to stop the symptoms, and these things don't just come with no side effects. And B, you're not getting to the root cause of the issue. We've talked about this with proton pump inhibitors. We've talked about this with thyroid medication. It's the case for so many different medications, SSRIs with depression. It's just symptom control. It's not fixing the underlying issue. At worst, statins are harmful, They can lead to severe muscle pain. They can lead to diabetes if you don't already have it. They can lead to all sorts of really not good things. And interestingly, one of the mechanisms by which statins work, one of the ways in which they're most effective is technically a side effect. Statins can have potent anti-inflammatory effects, and as we'll talk about, inflammation is the main cause of high cholesterol. This idea that that statins, the main way they work is by working on this HMG-CoA reductase enzyme that has a role to play in your cholesterol levels. But actually, one of the most effective parts about these statins is the fact that they have these anti-inflammatory side effects, and a lot of people hypothesize this is one of the reasons why they tend to be helpful, not the HMG-CoA reductase parts. One other thing I didn't list up here, but that is tremendously important, and again, differentiates conventional medicine from functional medicine. Cholesterol is not in your body to harm you, just like stomach acid isn't in your body to harm you. Cholesterol, believe it or not, is a very, very, very important precursor to all of your hormones, your adrenal hormones, your sex hormones. They are all made in one way or another from cholesterol. It might surprise you to know, in fact, that 75% of the cholesterol in your body is produced endogenously, meaning that it's produced in the body, and only 25% comes from the food that we eat. Why? Because cholesterol is so incredibly important to the function of not just our brains, but our hormones and many other things in the body. So this idea that cholesterol is just this harmful thing that we need to minimize at any possible cost is just really a misguided notion, and it's leading to very, very, I would say, misguided ways of treating people. I would say that there are a lot better ways to go about fixing or healing this issue. So we've talked about the standard of care, what's wrong with the standard of care. Now, let's talk about what really causes heart disease. Now, I just mentioned a couple minutes ago Chris Krestor's high cholesterol action plan, and I have to give credit where credit's due here. His way of conceptualizing the issue and listing the main causes, I've learned a tremendous amount from him, and I really think if you are interested in this topic, you should go out there, Google it, and look it up. He is just the best person I know by far on this topic, hands down. So let's talk about some of the things that can cause heart disease. So the first one is elevated LDL particle number. I talked about how LDL particle number is a better marker for heart disease risk than just standard LDL. Now, again, we'll maybe cover this in a different video, but it'd take a long time to talk about why that's a major cause of heart disease. Today, we're just going to talk about what actually causes elevated LDL particle number. The number one thing that causes elevated LDL particle number that quite a few people are dealing with today is insulin and leptin resistance. Insulin resistance happens when you eat foods that spike your blood sugar. Blood sugar in the bloodstream is toxic. So if it's left there for too long, it can lead to all sorts of bad things. So if your blood sugar spikes like this after you have your bagel and OJ in the morning, your body releases insulin to try and bring the blood sugar spike down. If those blood sugar spikes happen too frequently, it leads to insulin resistance, where your body has this saturation of insulin, but the receptors for it become resistant because there's too much of it. The same thing happens with leptin, which is your main master hormone telling you that you're full. Leptin is secreted by body fat, in particular belly fat, and if too much of it is secreted, you become resistant to it. So you'll notice here that the number one cause of elevated LDL particle number, and by extension heart disease, is not genetics, contrary to popular belief. It's insulin and leptin resistance, which is a lifestyle issue, something that we can correct by fixing blood sugar. Other things that lead to elevated LDL particle number and out of whack cholesterol numbers, just in general, just by the way, are thyroid malfunction. So we've talked about this in other videos. If you have hypothyroidism, where your thyroid is going too slow, chances are your cholesterol numbers are going to be high. But that doesn't necessarily mean that your cholesterol numbers are high. It doesn't mean that your cholesterol numbers are definitely high, but it doesn't mean that you have a correspondingly high risk for heart disease. What it could mean is that your thyroid is not functioning properly and not clearing cholesterol the way it should clear it. In fact, it used to be the case that one of the diagnostic criteria for hypothyroidism a long time ago was high cholesterol. If you have Graves' disease or autoimmune hyperthyroidism, typically your cholesterol numbers are very, very, very low no matter what you're eating. And again, this is because your metabolism has sped up. So, just looking at cholesterol numbers doesn't tell you the root cause of what's going on. Again, this is a symptom, not a disease. So you could have something deeper going on, like a thyroid issue, that is causing your cholesterol numbers to be out of whack. Gut infections have been known to increase LDL particle numbers. So if you have a parasite, a bacteria, a yeast, things that shouldn't be there or that have overgrown, that can lead to issues. And of course, genetics. Absolutely, genetics play a role, but they play a much smaller role than we typically think. Like I said, if someone has 2 copies of the ApoE4 gene, or even if they're just a carrier, which I believe, if I'm remembering correctly, is about 25% of the population, there can be issues. But just like C-sections, just like antibiotics, just like proton pump inhibitors, just like SSRIs, all of these things can have a use in very acute instances, but we dramatically overuse these things today. And the same holds true for statins based on the idea that, genetics is the main cause of heart disease. What's the other main cause of heart disease? Besides elevated LDL particle number, the oxidation of the LDL particle. So we all know about, or we've all heard about antioxidants, right? We're trying to minimize oxidative stress. This is what's going on here, where LDL particles get damaged by this process of oxidation. Now, there are 2 pieces here that we can't really do too much about, or a little bit about. Over time, the LDL particle is subject to more and more oxidation, and time just kind of flows the way it flows, so there's not too much we can do about that, unless we can magically go back in time. The inherent vulnerability of the LDL particle, by its very nature, the LDL particle has some fats in it that are prone to oxidation, but a lot of the risk of oxidation of the LDL particle has to do with poor antioxidant status, i.e. not eating enough foods with antioxidants in them, and also increased oxidative stress. And this can come from all sorts of different things. It can come from stress, lack of sleep, an inflammatory diet, not exercising. All the things that you think of when you think of unhealthy living come along with that. So a lot of the things that we typically think of as leading to an unhealthy lifestyle are also leading to heart disease. So we've talked a bit about the standard of care. We've talked about what's wrong with the standard of care. We've talked a bit about what truly causes heart disease, and I'm sure in future videos we'll go into even more depth about why these 2 in particular cause heart disease. But now I want to finish up the video by talking about how can high cholesterol be fixed. Well, again, the first thing to recognize is that you don't just want to treat the test results. I'm a functional diagnostic nutrition practitioner, and that's one of our fundamental tenets. One of the fundamental misguided practices of conventional medicine is, your progesterone's low, here's some progesterone. Your testosterone's low, here's some testosterone. I think maybe your serotonin might be low, you might have some depression. Well, here's an SSRI. You have high cholesterol, here's a statin. Don't just treat the test results. These numbers are correlates. They are markers indicating something in the direction of the issue you're trying to get to, but the numbers themselves aren't the problem. High cholesterol is a symptom, not a disease. And by artificially lowering those numbers, you are not necessarily lowering the risk of heart disease. You need to figure out why. The most important question when someone has low testosterone is why. The most important question when someone has low serotonin is why. The most important question when someone has high cholesterol is why. A normal, healthy, functioning human being does not have any of those things. And if they do, there's a reason. And in order to really fix the issue, you have to get to the heart of the reason. So just from a philosophical perspective, before you even do any sort of natural healing or fixing, you have to understand that high cholesterol is not the issue. It's not the problem, it's the result of the problem, Okay? Now, once you've realized that, there are a lot of things that you can do from a natural perspective to try and fix this. So, correct insulin resistance. One of the major sources of inflammation that we all deal with on a day-to-day basis, especially for eating blood sugar spiking foods, is insulin resistance. And there are degrees of this. It's not like you're either insulin resistant or you're not. There are degrees. So, to the extent that you can get healthy blood sugar levels and better insulin response back, that will help dramatically. Getting your thyroid health back in line, fixing any gut infections if they happen to be there, decreasing oxidative stress and increasing antioxidant levels, and just more broadly, increasing overall health. And that's exactly what we do with functional diagnostic nutrition. With functional diagnostic nutrition, we don't diagnose or treat anything specifically, but rather we work on the person overall. We help the person get back to optimal health, and as a result of them getting back to optimal health by fixing all these things in a non-specific fashion, typically the symptoms of ill health, like high cholesterol, like low testosterone, all the rest of those things tend to get restored. So if we follow, proper diet, rest, exercise, stress reduction, supplementation, and if we do functional lab tests to figure out what is going wrong at the root cause of your health, then we can actually restore optimal health and make it so that your cholesterol numbers and your heart disease risk go back to where they should be and fix the root issue, not just treat the symptom. All right, guys, so a lot of information today. Hopefully you now have a better sense of what's wrong with the standard of care when it comes to high cholesterol, what really causes heart disease, and how high cholesterol can actually be fixed at a root cause level. All right, guys, thanks so much for tuning in. We'll see you next time.